Cyclosporine Modified 100 mg per milliliter oral solution is a medication that is used to prevent organ rejection in people who have received a liver, kidney, or heart transplant. It is usually taken along with other medications to allow the new organ to function normally. This medication is also used to treat severe cases of rheumatoid arthritis and plaque psoriasis. In these conditions, the body's defense system, immune system, attacks healthy tissues. Cyclosporine belongs to a class of drugs known as immunosuppressants. It works by weakening the immune system to help your body accept the new organ as if it were your own, in the case of an organ transplant, and to prevent further damage to your joints, in the case of rheumatoid arthritis, or skin, in the case of psoriasis. The dosage of Cyclosporine Modified 100 mg per milliliter oral solution is based on your medical condition, weight, and response to treatment. It is important to take this medication exactly as prescribed by your doctor. The best time to take this medication will depend on your specific medical condition and your doctor's instructions, so be sure to follow their guidance. It is important to take this medication regularly in order to get the most benefit from it. If you have any questions or concerns about your dosage or the timing of your doses, be sure to talk to your doctor. When taking Cyclosporine Modified 100 mg per milliliter oral solution, it's important to follow your doctor's instructions and take it twice a day. You can take it with or without food, but it's best to choose one way and stick to it for every dose. The dosage is determined by your weight, medical condition, lab tests, and how you respond to the treatment. Use the medicine syringe provided to carefully measure the dose. Avoid using a household spoon as it may not give you the correct dose. To make the taste better, mix the measured dose with a glass of room temperature orange or apple juice. Don't change juices often, and don't mix it with milk. Use a glass cup and drink all of the mixture right away. Don't prepare a supply in advance. After drinking the mixture, rinse the glass with more juice, then mix and drink. Make sure to consult your pharmacist if you have any questions. After using the syringe, dry the outside and do not rinse it with water. If you need to clean it, make sure it's completely dry before using it again. Avoid eating grapefruit or drinking grapefruit juice unless your doctor or pharmacist says it's safe, as it can increase the chance of side effects. Use this medication regularly at the same times each day to get the most benefit from it. It may take up to 4 months to see the full benefit of this drug for the treatment of rheumatoid arthritis and psoriasis. If your condition doesn't improve within 4 to 8 weeks for arthritis or 2 to 4 weeks for psoriasis, or if it gets worse, be sure to tell your doctor. Some common side effects of Cyclosporine Modified 100 mg per milliliter oral solution may include shaking, headache, dizziness, unusual growth of body hair, nausea/vomiting, diarrhea, stomach upset, or flushing. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. You may also experience unusual growth and swelling of the gums. To reduce this problem, make sure to brush your teeth and floss daily, and see your dentist regularly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. This medication may also raise your blood pressure, so it's essential to check your blood pressure regularly and inform your doctor if the results are high. Your doctor may need to manage your blood pressure with medication. If you experience any serious side effects, such as signs of kidney problems, signs of liver disease, easy bruising/bleeding, unusual tiredness, muscle weakness/spasms, slow/irregular heartbeat, numb/tingling skin, severe leg pain, mental/mood changes, vision changes, problems with speech, clumsiness, loss of coordination, weakness on one side of the body, seizures, or chest pain, seek medical help right away. Although a serious allergic reaction to this drug is rare, it's important to get medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects or report side effects to Health Canada. Cyclosporine Modified 100 mg per milliliter oral solution is a medication that may lower your ability to fight infections, which could make you more susceptible to serious infections or worsen any existing infections. This medication may also increase your risk of certain types of cancer, such as skin cancer and lymphoma. It's important to notify your doctor if you experience any signs of infection or cancer, such as a persistent sore throat, fever, chills, cough, burning or frequent urination, unusual skin changes, changes in moles, unexplained weight loss, swollen lymph glands, unusual lumps, or night sweats. Additionally, cyclosporine can lead to high blood pressure and kidney problems, especially with higher doses and longer treatment. Your doctor will monitor your blood pressure and kidney function while you're taking this medication. For patients with psoriasis who have undergone certain previous treatments, the risk of developing skin cancer is increased. It's essential to discuss the risks and benefits of using cyclosporine with your doctor. It's also important to note that different brands of this medication may deliver different amounts of the drug, so it's crucial not to switch brands without your doctor's permission and guidance. As for the daily dosage and timing, follow your doctor's instructions and take the medication at the same time every day. Before taking cyclosporine, make sure to inform your doctor or pharmacist about any allergies you have, as this product may contain inactive ingredients that could cause allergic reactions. You should also tell your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, high blood pressure, cancer, skin lesions of unknown cause, recent/current infections, high cholesterol/triglycerides levels, or if you have had radiation treatment or have a mineral imbalance. It's important to note that this medication may make you dizzy, and alcohol or marijuana can increase this effect. You should avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Also, if you are using marijuana, cannabis, it's essential to talk to your doctor. Additionally, if you are pregnant or breastfeeding, or have liver disease, alcohol dependence, or any other condition that requires you to limit or avoid alcohol in your diet, you should exercise caution when using this medication. It's best to consult with your doctor or pharmacist about using this product safely. Cyclosporine can increase your risk of getting infections or make current infections worse. You should avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. It's important to talk to your doctor if you have been exposed to an infection or for more details. This medication may also increase your risk of developing skin cancer, so it's essential to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Your doctor may also advise you to avoid phototherapy while using this product. Furthermore, cyclosporine may increase your potassium levels, so it's important to consult your doctor or pharmacist before using potassium supplements or salt substitutes that contain potassium. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be at greater risk for kidney problems or high blood pressure while using this drug. During pregnancy, this medication should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so it's essential to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with cyclosporine modified 100 mg per milliliter oral solution. Some products that may interact with this drug include coal tar, orlistat, and other drugs that weaken the immune system or increase the risk of infection. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, other medications can affect the removal of this drug from your body, which may affect how cyclosporine works. Examples of affected drugs include bosentan, mifepristone, St. John's wort, and ritonavir, among others. It's important to discuss any potential interactions with your doctor or pharmacist. It's also important to note that this medication can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include aliskiren, dabigatran, and certain statins, among others. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much Cyclosporine Modified 100 mg per milliliter oral solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to note that Cyclosporine Modified 100 mg per milliliter oral solution should not be shared with others. If you are taking this medication, it's crucial to undergo lab and/or medical tests to monitor kidney/liver function, blood pressure, blood mineral levels, cyclosporin blood levels, complete blood count, uric acid levels, lipid levels, and skin exams. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you have had an organ transplant, it is recommended that you attend a transplant education class or support group. It's essential to learn the symptoms of organ rejection, such as feeling ill, fever, pain around the transplanted organ, and signs of a failing transplanted organ, a decrease in the amount of urine with kidney transplant, yellowing of the skin/eyes with liver transplant, shortness of breath/inability to exercise with heart transplant. If you experience any of these symptoms, seek medical help right away. If a dose is missed, take it as soon as remembered. If it is close to the time of the next dose, skip the missed dose and take the next dose at the regular time. Do not take a double dose to make up for the missed one. When storing Cyclosporine Modified 100 mg per milliliter oral solution, make sure to keep it in the original bottle at room temperature, do not refrigerate it. Avoid storing it in the bathroom. Once the bottle is opened, use the solution within 2 months. If the solution is stored below 68 degrees Fahrenheit 20 degrees Celsius, it may thicken and form particles, but this does not affect the medication. If this happens, store the solution at room temperature to allow it to warm up. Keep all medications away from children and pets. When it comes to disposing of the product, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of the medication, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.